Many thanks for watching his Breakfast Central on a Wednesday, 2nd June 2021. Our top story, first of all, takes us to South Africa, where the rights of children in the country are in the spotlight this week as the country marks a National Child Protection Week. Now, South Africa has been marking Child Protection Week since 1997 as a campaign of annually to engage, educate, and keep the families and children in communities safe.
Now, the theme for this year's week is Let Us Protect Children During COVID-19 and Beyond. Joining us this morning is Dr. Shaheeda Omar from the Teddy Bear Clinic in South Africa, which provides help to children who have been abused or neglected. Good morning, Doctor.
Good morning to you and all the viewers out there. Thank you for this opportunity.
Thank you for joining us on Breakfast Central. Now, tell us, why is it so important in South Africa to mark the Children Protection Week as it is in South Africa now?
So I would like to clarify one thing. Yes, it's Child Protection Week. We've started the launch 2 days ago, but child protection is not only during Child Protection Week. It's every day, every hour, every minute, every second. It should be a 365-day campaign, and that is what we propagate, the protection of children at all times by everybody, and together we can all protect children, ensuring their safety and security and protection.
Yes, indeed, Dr. Shaheeda, well pointed out, goes beyond the week. But the theme for this year's, child protection during COVID is, what are some of the biggest challenges children in South Africa have been facing in terms of COVID-19 so far?
So if we just reflect on a year ago, I think the challenges were, at the time, it was unprecedented. It hit us totally, in a state of feeling helpless and hopeless and not knowing what to do. And of course, many families and children fell through the cracks at the time because there were no protocols on dealing with the pandemic. Both government and civil society were actually trying to pick up the pieces. But reflecting on the past year, I would like to actually express that protocols have been put in place, referral pathways have been created, a directory of services of who, what, where, when, and how, and also backup plans, so plan A, and then of course contingency plans, because the challenges that we experienced last year in 2020 was that very often when children were entrapped and supposed to be safe at home, many of them were actually not safe. They were being violated at home. Both mothers and children were victims of physical, emotional abuse, neglect, and even sexual abuse. And I think that was a huge challenge because they could not actually leave their residence, or they were afraid, fear of reprisal from law enforcement because of the lockdown. So the challenges that we continue to face, of course, is the loss of household income, increased unemployment, food insecurity, and even children's mental state, physical and mental state, still being compromised because children are surrounded by death and dying. The anxiety levels have increased. We are also faced with post-traumatic stress disorder, where children are suffering, because of the confusion, the uncertainty, the insecurities. And of course, this is all contributed to household challenges where there's frustrations, angers, tempers flaring, and the outcome is not always positive. So these are just a few of the challenges. Last year, we know that many of the schools were shut down and children were trapped at home, and parents were faced with, of course, the responsibility not only of providing food and security, but also looking at how to stimulate their children. Suddenly, some of them had access to the internet, many did not have access to the internet. So children were deprived of all forms of stimulation, education, and of course nutrition, where schools were providing food. So the food insecurity certainly contributed to the compromised the physical health and well-being of many children and families.
All right, now, Dr. Omar, you've mentioned quite a number of challenges that the children were facing, especially in the year 2020. And some of these challenges you've also highlighted that there are challenges that the children face even beyond COVID. So these are some of the things you've highlighted to us. Now, if you have an opportunity, if your organization has an opportunity to speak with the government, what are some of the calls that your organization would like to make to the government in terms of improving child protection in South Africa?
Well, I think the first thing government needs to actually look at putting a budget, increasing the budget to child protection. They need to sit with National Treasury, because children are our future generation and future leaders. And the reality is, if we just look at the child support grant, as we speak now, the increase in the child support grant was absolutely shocking, in an increase of 10 rand for this year. Now, these are already families in dire need, families who do not have and who cannot provide for the basic needs. So that is something that government firstly would need to look at. But government also needs to work closely with civil society organizations, your faith-based organizations, your community-based organizations, because this needs to be a collaborative effort which is integrated and of course implemented into societies. Also opportunities for small business development, entrepreneurship, and also ensuring that food is not it's not a luxury, it's a right to every child I think not only in South Africa, but I think for every child that exists in the world. So these are things that the government needs to look at. But I also want to just express something which I think is critical.
Okay.
Is that so many innovations occurred during this period, where previously we were seeing children face-to-face. Counseling and therapy and support was provided to families. With the lockdown, this was not possible, sometimes because of financial constraints, but also because of the total shutdown, lockdown period. So civil society organizations became quite creative and actually looked at using smart devices, getting sponsorship from your service providers like Vodacom, MTN, Cell C, and, and getting data to the children to reach out to them and provide support, whether on WhatsApp or FaceTime or any other opportunity to engage and contain children during this crisis.
Well, thank you so much, Dr. Shaheeda Omar, joining us from Johannesburg about the National Child Protection Week in South Africa. And just like you said, Dr. Shaheeda, it goes beyond this week. Child protection is also constant and should be a right in terms of food and protection for children. Thank you once again from Johannesburg.
Thank you.